Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Tryptans. Tryptans are partial 5-HT1B1D receptor agonists. They have poor bioavailability except that we have probatriptan. This probatriptan has around 75% of best oral bioavailability. Then the most potent tryptan is actually a naratriptan. Most potent tryptan is naratriptan, and most efficacious tryptan is actually rizatriptan, and this rizatriptan is also longer acting or longest acting tryptan and most efficacious tryptan. Both tryptans and also ergots both tryptans and ergots, both these can precipitate the coronary vasospasm. Because they can precipitate the coronary vasospasm, they will worsen the ischemic heart disease. They might cause myocardial infarction, and they are also contraindicated in ischemic heart disease. Then these tryptans are actually the shortest acting tryptan. The shortest acting tryptan is sumatriptan. Sumatriptan is shortest acting tryptan, and naratriptan is the most potent tryptan. Rizatriptan is the fastest acting and the longest acting tryptan. This fravatriptan has 75% oral bioavailability. It is also the long acting anti-migraine drug. Long acting anti-migraine drug is fravotriptan, and it is also the slowest acting drug. Fravotriptan is the slowest acting drug.
thank you and thank you for watching.